introduction, and then we are. Hello and welcome. I'm Hilda. I'm a librarian here at the Los Angeles Public Library, and today's program is Ask a Physician, Clinicians and Grief, Understanding Medical Encounters Through a Grief Lens with Dr. Donald Moore and Elisa Fornere. This is part of a larger series called Ask A that will continue in person at the Washington Urban Library starting on July 20th at 10 a.m. So one more thing is that this program is being recorded, so if you miss any part of it, make sure to watch the playback here on YouTube, on the library's YouTube channel. And now I'll hand it over to Elisa and Dr. Moore.
Thank you, Hilda. Thank you, everyone who's able to join today, but also all of the folks who will be watching this after. My name is Elisa Fornere. My pronouns are she, her, and I am the founder and executive director of Pause. As a human, beyond what I do, for my professional life, I'm also a mother. I'm a daughter, I'm a wife, I'm a sister. I said on our webinar yesterday, I'm also a gardener. I'm rotating my beds right now. So just really throughout this summer and the last year, been really trying to move away from death work into bringing plants and living beings into life. And then I'm also a cookbook lover. So yes, I talk about death and grief every single day for work. But beyond that, I hold many roles and am a person very much outside of that. I would love before I get into this conversation with our guest, I want folks to also share about yourselves or to share about a little bit of sort of like how you navigate the world. So I'd love for folks to share their name, how you ended up here today, what about talking to or asking questions of or learning from a physician that's focused on end of life piqued your interest. And then a question for everyone, including always the library staff that are on here. Have you done any end of life planning? Have you thought about end of life? Have you thought about the plans that you want to put in place? Have you thought about your wishes and your desires for your own death and dying process? A couple options. Yes, you've thought about it a lot. Maybe you've thought about it a little bit, but you haven't addressed or haven't actually tackled everything that you hope to get done. Maybe you've never thought about it at all, and that's why you've ended up here today or interacting with us in this series. And then the other option that I put on here last week was maybe you're not sure. Maybe there are some things that you think could be helpful. You might be more prepared than you thought, and maybe some of that will be revealed to you today. And then the last just sort of landing question for us here, it's lunchtime. And so I am very curious for folks to land here in the session today. What food would bring you comfort at the end of your life? And I'm also going to invite our speaker to share answers to these questions after I do an introduction. But so what's your name if you're here today? How did you end up here? Have you done any end of life planning? And what food would bring you comfort in those last moments of your life or as you navigate transitioning? So who we are as an organization, we're a nonprofit based here in Los Angeles called Pause, and our mission is to create spaces that produce safe, culturally specific, and expert-informed grief and end-of-life resources, specifically serving communities of color. So our work really lives at this intersection of grief support and end-of-life support, education around grief options and grief support options and end-of-life planning options, but also community care and rest and healing. With this work, with the activation for any of us around thinking about our end-of-life plans or our end-of-life experience, it's a true sort of like responsibility and call for us as an org to also balance that with how do we do that in community so that we have support? How do we do that backed up against rest and against modalities that might be for healing as we're processing grief, or healing as we're thinking about end of life and planning for that? So we believe that all of this planning ahead for some might be, triggered or manifest or be started because it's coming from a place of fear or wanting to take care of the folks that are in your life or your circle. But we also love for folks to sit with the fact that planning ahead, having these conversations, showing up proactively, like you are listening to this webinar here today, or in any of our in-person sessions that we'll be hosting for the next 12 months, it can also bring about clarity about what you want, how and who you should communicate that to, dignity around how you can have your wishes and your desires and your plans carried out and honored in a way that feels dignified, and then also care. It can mean that we get the care that we receive, we can advocate for the care that we receive, and that we can be cared for in a way that truly aligns with who we are, whether that's based on our individual identity or the culture that we hold, but to have care really baked into the experience from proactive planning. A couple of agreements and disclaimers that we hold in all of these sessions. So we invite folks to come as you are. We expect nothing from anyone. We invite you to share whatever feels comfortable if we ask questions, or invite folks to ask questions, which you are more than welcome to. But also, we do not expect folks to leave here with a plan. We do not expect you to stay if this stirs something up inside of you that you need to sit with. This is all being recorded, and you can return to it whenever feels right. And also, we want to agree to, and I think sort of hold ourselves as an organization at Pause responsible to honoring the deep complexity of how grief and mourning practices and health and death and dying and serious illness all intersect with our identity and show up in LA. So there might be things that feel like generalizations, or there might be things that feel like maybe that doesn't quite fit exactly with the way that you want to see your end of life wishes carried out, or you want to be held in your community. But what this conversation and all of these series are really about is how do we start conversations with folks who are experts with lived experience and just backgrounds in this space, to at least give us a starting point, to give us examples, and to talk about the complexities of this work, but also then to be able to, for us, to be able to refer out. So my last sort of section and our last disclaimer here is that this space is really for education. This is not legal advice. This is not specific medical advice to you. But that said, in all of these sessions that we're hosting as an org and that we're hosting with the library, we have an exhaustive list of referrals. The folks that we're bringing in to have these conversations with our team are definitely incredible people to rely on and get in touch with. But though this is not space where we are giving you specific legal or medical advice, we are committed to, as an org, really at the root of what we do, to making sure that if you have questions, you need support, or you need a resource, we are here to talk and make that referral in any capacity that we can. So the last thing I'm going to start with before I introduce our guest is a quote that I land all of our sessions with. It's a quote to me that really, I think, exemplifies and embodies how we show up in this work, how we invite you to show up in this work, and how we really design the spaces that Pause invites folks into. We invite folks in with a sense of questioning, curiosity. Some folks we know land in our sessions with confusion and they have nowhere else to go to ask, how do I figure this out and who can help me? And so this quote really, for me, that I top of all of our sessions is an invitation to be in that questioning and that curiosity with us. So what's so gracious and wonderful and powerful about saying we don't know is that inscribed in the DNA of that sentence is, can you help me figure it out?
Mm-hmm.
Why would we want to be absolute? Why would we want to be perfect? Those are all synonyms for loneliness, because if we knew everything, then we wouldn't need each other. What's pretty gnarly about not knowing is that we get to ask questions. And what's pretty cool about a question is that it's an invitation to community. So this session and all of our sessions really are, starting from this place, and particularly this Ask Us series is we're here to ask questions. I'm here to learn. Folks are here to learn from each other and to maybe ask questions that you can't ask someone else, that you don't know how to ask it or how to put the words together or what the question even is that's sitting inside of you. So today is about asking questions and listening and getting answers, and also just being present with someone that is willing to give us like such, just to have such generosity with their wisdom and their experience, and stories that they can tell. So with that, I'm going to introduce, I don't know. They asked me, I was just going to say, I'm going to introduce Donnie, but I'll call you Dr. Moore. That feels a little more professional today. But just to read your quick bio, and I'll invite you to
Donnie's fine too. Not much of formalities. You're all right.
Dr. Moore brings a rich background in healthcare and commitment to patient-centered care. His dedication extends beyond a patient's physical needs, emphasizing the emotional and spiritual dimensions of end-of-life care. With credentials from prestigious medical institutions and hands-on experience across various healthcare settings, Dr. Moore is equipped to guide patients and their families through this profound life transition. I invited you here today. I am so glad that you're here with me answering some pretty big questions. You've looked at them. I'm like, these are big ones, right? But they're ones that a lot of folks sit with. And I just want to thank you first for your generosity of, like I said, your time and your willingness to be here. And I would love to just invite you first to share with us. I think really for my first question is what led you into this work? How are you here today doing the work that you do?
Yeah, I'd be happy to speak about that. And you can hear me okay? I just want to clarify. Okay. So for me, what really led me here, I think it was I don't know, it's hard to condense it into, sort of ending up as an end-of-life physician. I think a lot of people who work in this space, I'm sure you resonate with this as well. You feel called to the work and you feel really drawn to it, for some reason that's sort of bigger than us all. But for me, I think within my medical training and within how I ended up in the hospice and palliative care space, I really found the path there when I was doing primary care, and specifically during my residency. I found that a lot of these conversations, some of the questions you're going to ask today, a lot of these just unknown questions about life and death didn't really feel like they were being explored in a super meaningful way in the general medical community. I just felt like there were plenty of people who were cycling through my clinic, cycling through the hospital, who didn't necessarily feel like they had space or had providers with necessarily the expertise to have conversations about end of life. And I just found myself naturally having these conversations. Again, I don't know what it is that draws me to that, but I think there's really a lot of richness in exploring people's lives and then seeing how that is now factoring in, and how their values and experiences are influencing their end of life wishes. So, once I sort of came to the realization that that was part of me, and found out that hospice and palliative care was an actual specialty I could explore, it only made sense. For me, it just clicked in. And, I was practicing in Michigan at the time, and I ended up where I'm at now. My practice is in San Diego for my fellowship in hospice and palliative care. And just got a really rich experience, education around end of life conversations and support. And then following that, really found myself in a position where I was so fortunate to be able to, start my own practice and, grow a supportive system for families and patients in a way that I saw was, sort of most healing. And that's what I've been doing since 2023. And that's a little bit about how I ended up here, the abridged version.
No, that's great. And I think I said this last week, and I say this all the time. I'm like, I studied writing and ethnography. I did not grow up saying, I am going to talk about death and grief and racism all day, every day as my career one day. But I think it's like you said, there's this calling, and there's also, once you, for me at least, once you get into it and start having those conversations, and like you said, seeing the richness and the value that it has to provide people with that space, it's, I don't know, for me, it feels like a privilege to be able to fill that gap, to have those conversations and to hold that space for folks. So I resonate. And I'm curious, you said a couple of words, like we're talking about end of life, you're talking about hospice and palliative care. Can you talk about sort of what your work entails and what you in your work can support people through in your practice?
Mm-hmm. Yeah, that's a really good question, because I feel like there's a lot of information lost in a lack of awareness. What does palliative care mean? What does hospice mean? What does end of life space look like? What does medical aid in dying mean? What is VSET, or voluntarily stopping eating and drinking? There's all these terms that in some ways don't quite grip onto what they're actually trying to say. So specifically with my practice, Autonomy Health, my main focus is really two things. I support patients in home-based palliative care, which I'll explain what palliative care is in a second. And then I also support patients and families through their medical aid and dying journey, and sort of from anywhere from diagnosis of a serious illness to being present with patients when they die is pretty much all encompassed under the practice. I think the first term is really palliative care. What is palliative care? Palliative care is a field that is, really enriched by its the members of the multidisciplinary aspect, where you have doctors, nurses, social workers, chaplains, a whole host of supportive staff who are trained in how to, support a patient and family once you get that really serious diagnosis. Or if you have a change in your condition where you've had maybe heart failure or diabetes or some chronic condition long term, and now your condition has started to shift to where we need to sort of maybe consider what the last stage or the later stages of the condition look like. And so this team really comes in and explores, what symptoms do you have that we can help out with? Symptom management, pain, nausea, vomiting, constipation is a big part of it. We help a lot of people poop in the field. And so what is it about, your physical body and your symptoms that we can help support you in? So we're kind of experts in that social matter. Another part of it is, how we really navigate the system at this part of the journey, the medical journey. Sort of a liaison between your cancer doctor and your surgeon and your internal medicine doctor and your primary care, and sort of like, how do we reconcile with what the medical system wants, and then explore who you are to also identify what you want and what your family wants and values. And then how do we really, coalesce all of this into, a good outcome and help support you throughout, until your death, until you've sort of, completed your journey with your condition. And so it's really like, again, it's multidisciplinary field supporting patients at the end of life, but not necessarily at the very end of life. And so then hospice as a field, hospice work includes a lot of palliative care work. Generally, all the things I described are covered by hospice providers. But what hospice is specifically is, it's a Medicare benefit, insurance benefit that covers, sort of support in the last 6 months of your journey. So in order to qualify for hospice, you have to have 6 months or less that, the medical system thinks is left, given your condition until you likely would die from your condition. And so, hospice specifically is supporting you through, again, those end of life conversations, symptom management, any equipment you might need around death and dying, in the last 6 months of your life specifically. So those are kind of like the two nuances that I think most people get a little confused with.
This is not in my list of questions, but I'm going to get back to the list. But you do this all day. I do this all day. These conversations, listening to this information, talking about these topics can start to stir things in folks, right? Whether they're here live or they're watching this later. What would you say to folks that are entering these kinds of conversations or educational spaces for the first time that are, maybe I wouldn't even put the word uncomfortable to it, but feeling something coming up in them? And this is maybe like the first time they're feeling that, but they want to learn more. They ended up here for a reason, but something is coming up. What would you say to those folks before we dive deeper? And maybe this is like, what do you say? I'm very curious in your practice, like, what do you say when you have to transition into these topics and conversations with folks that maybe had hope for a different outcome or a different expectation?
That's such a good question. That's like at the heart of the field is how do you engage when it is stirring up things in people? Because this as a society, and I'm sure a lot of people who are here who are more curious know this, that as a society, we are not generally super excited to talk about death and dying. It's not something we really engage with a lot. And so, when you start these conversations and there's resistance, I think there's a couple things. I would say first, if you're feeling those feelings, listen to them, respect them, sort of try to befriend them in a way that allows you to understand where it's coming from. When we have these feelings, when we have these things inside of us, they're stemming from some experience we've had, or they're trying to protect us in some way that is sending off those sort of like alarm bells. And so, for a lot of us, it's that maybe we've never engaged with this, and death is the ultimate unknown. And so we really need to grapple with what's really scary about it and what's worrying us about it. For others, it's intense love. If it's coming up surrounding the conversations of death and dying of somebody, your person, your people, I think that really can stir up something that's like a grief already, a pre-grief. We haven't even gotten there, but and so really like understanding where that feeling is coming from, I think is essential, no matter if you're feeling it yourself or if you're a provider or a family member who's hoping to talk to somebody about this and sensing it in them. And then I would say once you've sort of, got past or at least met that uncomfortable feeling you mentioned, I think the most valuable lesson in exploring death that I found is exploring life. How we live is how we die. And as we approach our needs and the support that we need as we're approaching death, it really stems from, how did we live our lives? What were our values? What were the most meaningful moments in our life? What were the things that really the secret sauce to that kept us going throughout all this? And digging into that first and exploring that in a really genuine and deep way, then sort of bridges to how's that changed? How are those maybe less accessible with where we're at now? Or what if they were less accessible? All these things that have really resonated with me throughout my life. And so then if they're not there, what does that look like? And what do I need to still feel held and human. And then through kind of exploring that bridge, we're able to approach death in a way that's not really like quite as scary, because it's really like following this arc of like your life, and we're able to still, provide enrichment and provide as much support as we can, throughout that arc. So that's just, I would say that's the basic approach.
No, I love that. And I think something that was coming up for me as you were talking, there were a couple things, but what really came up for me is what you were saying about this connection between our values and how to start these conversations based on what we want, right? I think about my mom died. She was on a ventilator at the end of her life. And when planning for the end of my life, I don't plan to go into, I didn't plan to go to my doctor's office and say, I don't want to be on a ventilator. Where that conversation can start, where these conversations can start is, who do I want to be in my last moments? How do I want to communicate with folks if I can? If I can't, do I want to be alive? And if I'm not, then what are the things that I want surrounding me? How do I want my body being treated? Like I know for me, a lot of the fear around these conversations stemmed from the like technicality and the morbidity. But if we zoom it out and think about, how do we want to be cared for and what mattered to us in our lives that can translate into a really beautiful experience at the end, that's a softer place to start, right? And I think you're giving us that permission to meet the uncomfortable feeling, but sit with it and acknowledge it and honor it, and then engage with these concepts and topics and conversations in a way that relates back to us as individuals and our values. And I think that's really helpful for folks to hear too.
Definitely. Yeah. I think so. I think and finding ways that work for you to engage too are really helpful. I think that there's, different ways that you can. Some people just having that heartfelt message, meeting between two people that trust each other is enough. There's some really good resources like the Death Deck is out there as a kind of a way to not gamify the conversation, but a way to make it a little bit more like less scary, because it is like it's a card game, but it like introduces these topics too in a way that like lets you then engage. And so I think finding the way that feels best for you around food and the table. Is it, with a couple drinks, if that's your family culture, just sort of like figuring out what you need to like have this conversation with it feels least scary, is like a good way to approach it too.
Wonderful. The question I was going to go into next, I think also piggybacks off of this, that a lot of that feeling can be stemming, like you said, it's coming from something, right? Our body is reacting to something. And sometimes that's fear of the unknown, like you said. And also, I think misunderstandings about what our actual options are and what the end of life can look like. So I'm curious, what are some of the biggest misconceptions that you are like, please think differently about this, or this is a conversation I have all of the time and I really wish people thought differently in this way? What are the misconceptions that you want to sort of, I don't know, myth bust today?
Myth bust. I like that. I think the first thing that definitely comes up is that, that talking about death is going to make you die sooner. And like, that seems like something like, oh, of course, it seems kind of silly, but I think that does come up in people's psyche. And it does come up even in active conversations that like, I don't really want to talk about this. If I talk about it, then like the system is going to maybe judge me differently if I put my wishes down that I don't want to be on a ventilator, or, my family's going to make different decisions. And so I think that that's really like that's a big thing, that like talking about death is not going to bring on death, bring it up. Also that, sort of similarly, I think there's a big misconception that especially for our parents, our grandparents, older spouses, that nobody wants to talk about this or is thinking about this. I think that comes up a ton for me, when this comes up, because I'll be out in the world and see people ask what I do. And then, there's always an initial version at parties or whatever. But then people, as they engage with like, their love about their thoughts about death of their loved ones, it comes up that like, oh, I've never brought this up because I don't think my grandpa really wants to talk about this. Or like, mom and dad probably don't want to talk about this. And what I've found, because I spend all my time with old people, and old people, and like in talking to them and giving them like these sort of safe spaces to engage in these conversations, I find that older people are thinking about this and they do want to engage about this, like, and they want their wishes known. We all want our wishes respected as we approach the end of life. We, want the people in our lives to feel empowered and supporting us. And, so in a lot of ways, I think that engaging it with your loved one is going to be, really, it then sometimes can be met with resistance, but that it's going to be like unwelcome. I find that, if it's approached in the right way, also isn't something that's super, super true. And I think just like, it's not even a misconception, but it's really a lack of information about, specifically like medical aid in dying and hospice and palliative care, that like these are accessible if you, especially for medical aid in dying, if you live in certain states like California, but that you have these options to begin with are just things that I just don't, I think, again, not quite a misconception, but that people know about it and that this is just sort of common knowledge that people aren't choosing is, I think something that I've found. People just don't know about their options.
Yeah, no, that's really fair to include there, because I think one of the things that I think about, and I don't know where this stems from. That's for my therapist to help me figure out. But this like idea and this feeling in my body before I learned about all of this and started doing this work 11 years ago was that dying is going to hurt. And that they're being ill, being in the hospital, having any sort of serious illness is going to be miserable and it's going to hurt. And learning about comfort care and palliative care as a practice and hospice as an option has completely turned around. And not that it's not going to hurt, not that they solve everything, but this idea that there's this whole part of medicine and death care and end of life care to make us comfortable and to make the dying process like deeply, deeply rich and individualized. And what I would hope it would be was, I think for me, such an important thing to learn. And so I think that's really helpful to hear, maybe not a misconception, but like you said, just a lack of understanding about, if we talk death, it's grim and it's morbid and it ends and whatever happens, happens. And we have no control. But to learn that there's, I think, almost more of a sense of control, and that there can be, I don't know, less pain and joy even at the end of life feels so new, I think, to a lot of folks that aren't deep in this work, and maybe who haven't watched someone die in a way that was deeply supportive.
Or experienced, they experienced one of the, I don't know, death, the bad death, but a death that wasn't comfortable and peaceful. That, just, most people aren't around people who are dying. And so they that one experience can then put them in a position where they, as you said, they see it as inevitably painful, uncomfortable, sort of like with tragic suffering. And there, as you said, there's a whole field that's devoted to helping people die well, comfortably, peacefully.
Okay. Next question. Because I'm thinking, okay, let's say in a dream state, everyone that encounters your work and everyone that encounters pause, it's like, I want to take advantage of all of these services and resources. And now I'm ready to go out in the world and talk to, like, the folks that you're saying, the folks, it sounds like they might be ready. So let's go have a conversation. What would you, and maybe you have like examples, like high level examples of how folks can navigate their readiness to talk about dying or planning or end of life, being met with other folks who are like, absolutely not. We don't talk about that in our family. We don't talk about that in our culture. We don't talk about that because I'm not old enough for that yet. I'm not sick enough for that yet. Or why are we having this conversation? We could be talking about anything else. So what can you sort of like maybe give some examples, but also just talk us through how folks can navigate their readiness being met with someone else who is either, let's say, not quite ready or avoidant or uninterested.
Yeah. I think yelling, screaming, general hostility, aggression is the best. No, no. I think you got to be a little patient with other people. I think that's key. And honestly, like, navigating complex family dynamics and family systems is like a big part of my work, because these are really hard things to pick apart and to explore, and they come from, like you said, like, I'm maybe the youngest child, so I don't necessarily feel like I have that voice, or there was something that happened. My dad was in the military and saw combat, and so I don't know how he approaches life and death. As with my dad's in the military, and so approaching that can be like a little challenging. This is me as the trained expert. So I think that first, taking a step back and realizing that not everybody will be on the same level of readiness as you is important. And especially if it's your care and you're in your own body living your own lived experience, and so how you feel and your wants and such. But just giving people a moment to catch up to where you're at is important. These conversations, while ultimately I think enriching, and people are willing to have them, not always at first would be the caveat there. And so you may have to try a couple times, couple different ways. But yeah, giving people some time to get caught up. I think, as I said before, sort of finding a way that feels most comfortable with whoever else you're having the conversation with, a way that feels maybe in line with other ways you've had challenging conversations, or just in a way that you think is the most comfortable for the unit, a family unit, and finding a way to discuss it in that context is really important. And then the third thing I would say is hold space for the fact that not everyone may also agree with your wishes and with how your view of this perfect end of life scenario that you were mentioning, how that looks may not look the same to them. One thing I encourage people to do is have your wishes down in what are called advance directives. Advance directives are forms that everybody should have, no matter what your age, that says, if I basically can't speak for myself, here's kind of what I want, here's a loose guide, and here's maybe who I want to speak for myself if I'm unable to do so. And I think really, it may not be your child. It may not be your son that's the best person to speak for your wishes if they don't necessarily agree with you. It may not be your spouse. And that can be kind of uncomfortable to sit with, but really keeping in mind that who you want to speak for you, if you're unable to speak for yourself, has to be somebody that's in line with, your wishes and values, so that you have the greatest chance of them being respected.
I appreciate this, because it sounds like you're sort of giving us these options, right? Yes, it is so wonderful. I want everyone having these conversations when the time is right and when the folks around them are ready. And at the same time, honor the fact that folks might feel differently. Honor the fact that you should have your wishes somewhere, whether or not somebody wants to talk to you about them, which is huge. And also, I really appreciate the invitation to think about what are other conversations that might be uncomfortable that we have over the course of our lives with the important people in our lives, and how can we mimic that or learn from that or be inspired by how we model those conversations and do it similarly here, right? I feel like, for me, when I think about my dad and conversations that we have had to have over time, it is not we're going to sit at a table and I'm going to look you in the eyes and we're going to talk about something I know neither of us want to be talking about. What has worked for us in the past to have those conversations? Are we walking and talking? Do we do it on vacation where we can go have a good time after? Do we do it over dinner? Do we do it on the phone so we don't have to be in each other's presence at all, but we know it needs to get done? And so it really sounds like you're giving us these options for how to navigate it, not as something that has to feel so out of the ordinary, but almost to do the opposite and to integrate it into our lives and our relationships in a way that feels as comfortable as possible.
Exactly.
Yeah, I appreciate that. We'll talk about grief in a moment, but on the back of this, kind of want to not hard pivot, but pivot in this context to medical aid in dying. I think that something like MAID might be one of those things. You're the expert. You're in this work deeper than me with medical aid in dying. But I would say it's maybe one of those things where an individual may make a choice that doesn't align with what everyone else expected to be the outcome for that person. And so it was just coming up a lot for me as you were speaking. And so can you talk a little bit about what MAID is and what the sort of like resources and support systems are that are out there? And maybe I would say even just like a moment or a snippet about what if this is the first time someone's hearing about it and it feels like something they might be interested in, but they're like, oh my gosh, my family would never, my partner would never, like this would land like a rock with the folks in my life if I chose to navigate my end of life this way. So yeah, just a little background. And yeah, what would you say to the folks who are coming up, maybe something's coming up for them that that feels resonant with them?
Yeah, I think this is it's a fantastic question. Both parts, because I think likely most, the majority of people on this call probably haven't heard about medical aid in dying. I mean, some maybe have. There might be a self-selecting amount of people who are willing to come engage in end of life matters. But also, studies are showing that most people in the population in California don't know that this is a legal option. And so most people might be hearing about this for the first time. Or if you bring this up to somebody in your family or your community as something you want, this might be the first time they're hearing it too. So there might be a little bit of a discomfort from, this sort of like unknown. This is new. This is novel to me. So just as like a background, medical aid in dying as a concept as it relates to what your legal options are in the states. There's about 13 states right now where medical aid in dying is an option. In California, it's been an option since 2016, so we're in our 10th year now that the law has been around. New York and Illinois just passed their own laws this past December, so those are starting this year as well. So medical aid in dying is an option when you have 6 months or less, sort of when you're hospice appropriate. Remember earlier I mentioned if to be on hospice, you have to have 6 months or less in your life given your current condition. And so for medical aid in dying, you also have to have a 6 month or less prognosis. You have to also be above the age of 18, so you have to be an adult. In most of the states, including California, you have to be a resident of the state in order to participate in it. Vermont and Oregon are the two where there's no residency requirements, but you have to be in the state. You have to be able to make your own medical decisions. So you have to have what we call decision-making capacity. If you were altered in some way, you were in the hospital, say again, all those things we outlined in our advanced directives came to pass, and you couldn't make your own medical decisions, then you're not able to do it. Somebody can't opt into medical aid in dying for you. And then you have to be able to take this medication. But essentially, if you meet these like qualifications and have somebody to support you, then you're able to go through this process where you have to have several visits with several physicians. There's some paperwork that has to be witnessed by other people to make sure you're appropriate for this. Once you've gone through this whole process, though, you qualify to get this medication that you're able to drink or administer, rectally. And within a few minutes, you fall into a very, very deep, relaxed sleep. And then the medication absorbs and slows your breathing and slows your heart. And so you're able to have assistance in dying a very peaceful death. And those are kind of the basics of it. There's a lot of nuance to it, but that's kind of the basics. And then, what I would say is if you have concerns that this might land heavy with people in your life, that they may not love the idea of doing this, which comes up for a whole host of reasons. religion, status in the family, cultural fear, stigma. I would say my biggest piece of advice is if this is something that feels like it might align with you, bring it up early. And this is really with all your end of life wishes, but specifically with this, I think that when people have a little bit of time to say, oh, this exists. This exists and is something that my mom might want, or now that this cancer has progressed, she's exploring, and really just a little bit of just a pause, if you will, just a little bit of like a beat to sit with it. I find that things go much better. When it's hard is when people haven't heard about it, don't know it exists, and then things are going really poorly, which is sometimes what it takes for their doctor or medical team to bring it up, unfortunately, or they just randomly hear about it. And so then it becomes kind of a mad dash in some ways. There's some delays built into the law, but if it's within a couple of weeks, then I think that can be really hard for people to have not known this existed and then come to terms with it and be sitting with it so soon. So I would say bring it up often, sort of educate yourself, arm yourself with resources in the form of knowing just a little bit about knowledge in the process and how to access it before you start the conversation too.
And thank you for that. And I think the other thing that comes up for me as I think about whether it's, proactive and early or late, what you're giving people in that pause and that moment too is the opportunity to take their own time to learn about it, to research, to talk to folks, and to understand it better, right? To understand it not just from your perspective and need, but to just really get information, which I think we've talked about throughout this. It's like the more information folks have, the better equipped we feel to accept something, to plan for something, and to have something land comfortably with us. So that's great. Just advice to folks from you. And I think, we have 10 minutes left. I want to, and it was coming up for me as you were talking about this, anticipatory grief and grief. So I want to discuss, at the end of our call today, grief and how grief shows up in this work, right? You are not only supporting people in your work through the, experiences of serious illness and palliative care, and then moving into hospice and then dying. And there's so much that comes after that. And grief comes even before that when we think about anticipatory grief, and intergenerational. But can you talk about how grief shows up in your work and how your work and other folks who work in hospice and palliative care not only are supporting people through the process of navigating health and serious illness and dying, but also all of the emotional and spiritual processing that is a part of our end of life experience?
Yeah, grief is it's by far one of the more complex, I think, aspects of end of life care. In many ways, I think the part that you mentioned about the anticipatory grief is so so challenging, because it does start before the loss. And you can grieve anything. I mean, grieving can come with any loss in life, any change or transition, grieving what once was and the potential of what was, and, the loss of that and what is. And so really working with grief early, I've found has been helpful for people in that, we really need to explore what that new normal in the grief phase is going to look like. And we really need to explore where those feelings are coming from. And, there's certainly people who are even much more adept than me at navigating this. And so I think it's important to explore early as well, just like all end of life matters. Explore it, feel it out, talk about it. And then, it really shows up in a meaningful way around when somebody's dying. And then I found, even afterwards, it's come up a lot, in a way that I explore. Not all people who support patients through medical aid in dying do a lot of bedside support when somebody actually takes the medication and dies. And for me in my practice, that's been something I've been I think is really valuable, and I've been intentional about like making a big part of my process is that I'm with most people when they take the medication, with their family. I encourage people to have, family present when it feels safe, and really whole communities. Sometimes they do big celebrations of life, like as they're there, as they're going to take it. But that comes up as a time too when I just talk to people about, what these emotions are that they're feeling, and how this transition is really landing with them and resonating, and what it's stirring up. And so we're able to, there's this window of time when somebody's fallen asleep but hasn't yet passed, where we are able to explore some of those things and sort of set the stage for once this person, as I mentioned earlier, these are your people. This is your, sometimes your most important person, somebody you maybe been with for 7 decades of marriage, who's now not going to be here. What does that feel like? What does that look like? And, what support can we ultimately have in place too, once this person is no longer with us? And then I've also recently established a grief group for families of patients who are going through, who've gone through medical aid and dying as well. And I found that that's helped. Having community is so important, and having empathetic community that understand the type of loss and the type of process you've been through is so important. So, and that's also, I've noticed, a big part of the process is encouraging people to find this community, and fostering that has also helped people through the grief process. But I will say, if you're grieving, or, and we all will be at some point, grief looks different for everybody. And grief is so hard and unpredictable and can go on for longer than you're told it should. And so I would just say, like, practice the ultimate self-kindness and self-empathy right now, or when you reach it, because it will show up in weird, sticky ways and may hang around a little bit. And so have some patience.
I appreciate that, like, permission that you're giving folks to be like, it doesn't have to pass. We can meet it. It'll also fluctuate. I talked about this yesterday in the webinar that we did, just about like the dual process model and oscillation. Like, grief is not just, it comes and we deal with it and then it moves on and we never see it again. And like you said, throughout any experience that we're having with illness or end of life, or in bereavement after a death, it comes and goes. It shows up when we expect it and least expect it. And so just the permission to sit with it, and also I don't want to say warning, that sounds so aggressive. The note that it is going to be a part of this feels important to land with folks today. I wish we could talk for like 7 more hours. I know.
It's going to be so
it feels like just a little tiny taste, but I would love for us to close, and then I'll give Hilda a couple minutes at the end just to talk about future programming. What, for the folks that stayed with us for the hour, or left and returned, or who were just able to like sit with any portion of this conversation or future conversations about end of life, what do you hope that the folks that have watched this and spent this hour with us take away? What do you wish for them?
Such a good question. So I think a couple things. I wish, or I hope that people leave here maybe just a little more curious, a little less afraid to find some information, to research deeper. You can reach out to either of us as support if you need to get more information. But I hope that people leave here a little more equipped. There's a lot of info, avalanche of info, and a little less afraid to maybe have some of these conversations, dig into these a little bit more into the information, and just better equip themselves to approach this and have these conversations, because I think they're so important. And so I think then the second part of that is, if you leave here with nothing else, like, please go and in some way put your wishes out there. It's such it seems macabre. It seems a little like bleak in some ways, But you know, I've had so many conversations in the hospital and in houses where, you know, the hardest part for family members, I mean, there's many hard parts, but one of the hardest parts for family members is when they're having to like make these decisions and they just don't know if they're making the right one, and they think they are because they really know this person, but they're challenged with like, did I make this, or did I make the right decision for my mom? Did I really know what mom wanted? And when you've done the hard work, because it is hard work, of putting down your wishes, having these conversations, doing your advanced directives, and letting people know, this is what I would want, this is what I wouldn't want. You know, I would want maybe a breathing tube, I wouldn't. I would want the CPR, I wouldn't. A feeding tube. It's just, it takes that burden off of your loved ones, and they're able to, you know, grieve without that unknowingness of whether or not they respected your wishes. So get your advanced directives and orders.
I love it. I feel like it's the invitation and the hope and the wish of like, I just hope that you're leaving with some curiosity and maybe do something about it. So what we'll do, a little bit of action. What we'll do after this session is, so we are going to continue this for the next year. We will be in person for all of the rest of the sessions after kicking this off today. And then, so what we send around is we'll send around a resource list to folks. We will also make sure that, you know, Dr. Moore's information is available to everyone. Our information at PAWS is available to everyone. Truly, I say this, I don't think some folks take me seriously, but I'm like, y'all, this is our job. Like answering your questions, being here to hold this space and being able to provide these services. Truly, my inbox is always open because this is my job and my life's passion. And so if you're looking for resources beyond what we send as an organization today, my inbox is always open. The public library has been an incredible partner and will continue to host these sessions with us. And that's what we're here for. So Donnie, thank you. I really appreciate all of your just like wisdom and experience. Thank you so much for sharing. And I think giving us both just really like soft ways to land into exploring this, but also very clear, actionable steps that we can take as anyone in this room or anyone in the future starts navigating their own end-of-life planning. So thank you.
Thank you for having me. Yeah, thank you for your wonderful, good probing questions. They were very useful. Happy to help with any future talks too. At all.
Thank you. For you. And Hilda, thank you for having us.
Thank you, Hilda.
That was so informative. And just as I thought, I was like, this is going to be such a good program, especially for me. I'm like super interested in this. I just wanted to, before we go into the ending credits, I guess, I wanted to mention that you touched on this. It's like, how do you bring this up? How do you bring up even advanced directives? Say for myself, I've mentioned this to like a partner before where I'm just saying, I mentioned in passing, you know, I want to make sure that if something happens to me, I'm not going to be in the hospital and I don't want to be in a coma for too long. I don't want to drag it out. And I've been met with a lot of resistance. It's like, no, don't think about that. You're, like you said, people don't like to talk about it because you might talk of death. And I feel like I've experienced this, but also I experienced a very Latina mom and grandmothers who very often were like, oh yeah, I'm going to die soon. My grandma was always like, I'm going to die soon. So you have to make sure this, and that. And my mom was always the same as well. She's like, you know, before I die, we want to make sure you do this. So it was like kind of ingrained in me to just kind of casually talk about it. And then I realized that it wasn't super normal for other people, maybe not even just outside of my own household even. Maybe it wasn't just a cultural thing. It was just my family culture. But you mentioned the death deck in passing, and I Googled it, and I was like, oh, this looks really interesting. Have you found, I don't know if have you used it in games? Have you found like people shy away from it? How do you bring it up? Are you just like, I have this game?
No, people are into it. It's like,
I love it.
It's one of the better tools that I have. I keep one right here. It's fine. No, so what better tools? Still, I'm not plugging for it, but it's to use. I carry them with me, and sometimes like there's just different ways that they ask different questions, and it's a really non-threatening way and a pathway for people to talk about it. It's got like a koala on it, and like it seems kind of like, it seems like very approachable. And so yeah, like I mean, if I'm having a hard time with a family, sometimes I'll bring it and then like just engage with them that way. I also just want to like validate and honor you. Like that's great that you brought it up to your partner, and I think like continuing to do that is one way that people can also build that culture. Like the culture comes from the fact that your ancestors and your family were willing to constantly say this, and so then that made you more comfortable saying it, and so continuing to bring it up while it might not get you invited back to one or two parties. Speak from personal experience. It is though, like continuing to bring it up with your loved ones, your community builds that culture. And so, I mean, that's the only way we can really change the society, I think, is everybody has to be a little bit more annoying about bringing it up. So no, I like, so definitely like, big ups to you for like bringing it up with your partners. Keep doing that. It'll get a little easier over time, I promise.
All right, so my takeaway is be more annoying about bringing it up for me.
Be more annoying about death and dying.
Yeah, okay. Okay, thank you so much. Again, thank you, Dr. Donnie Moore. Thank you, Elisa. Again, to everybody, a reminder that this whole program has been recorded. So if you missed any part of it and you want to go back and check out the conversation, you can check out the playback here on YouTube. So check that out. And again, a reminder that this program will continue in person, and there's going to be different locations, but this specific one that we're going to bring up is the Washington Irving Branch Library, and that will be on the 18th of July, which is coming up really soon. Just making sure that I'm looking at the right date. Yes, at 11. Sorry, no, not that one. It is the 27th.
27th? Okay.
The 27th, sorry. The 27th of July at 11 a.m. I'm trying to make sure I'm getting the right dates, but
we'll send it all around.
Yeah, we'll send it out, and it will be on the online calendar for the library. So please check it out. Thank you so much for joining us, and thank you both again for this informative session.
Thank you so much.
All right, everybody. Have a great day.
Bye.